Hey there, I'm Scott McKenzie, founder of home care agency Blueprint, and if you're watching this, chances are you're feeling called to step into something bigger. Maybe you've been a caregiver, maybe you've watched someone you love struggle to find quality support, or maybe, just maybe, you're one of those visionary souls who knows you're here to build something that actually makes a difference in people's lives. Today we're diving into how to start a non-medical home care agency in Wyoming. We'll talk about what the process really looks like, how long it takes, what it costs, and I'll share a few rare insights that most coaches don't really talk about. So let's get into it. First thing to know, in Wyoming, starting a non-medical home care agency, meaning companion care, personal care, help with light housekeeping, errands, bathing, medication reminders, and so on, is a bit different from states with tighter regulations. Wyoming does not require a full-blown state-issued license for non-medical home care. What you'll typically need is to register your business properly and make sure you're fully compliant on both the business and care side, even without a formal license requirement. That said, oversight still matters. The Wyoming Department of Health doesn't license non-medical agencies the way they license skilled home health agencies, but that doesn't mean you can just throw up a website and start hiring caregivers. You still need to take this seriously because liability, reputation, and long-term success depend on doing it right from day one. Let's talk about startup costs. To register your home care business in Wyoming, you'll start by forming an LLC or a corporation. Filing your LLC with the Wyoming Secretary of State is very affordable, just $100 as of now. There's no annual report fee for your first year, but starting in year 2, you'll pay a small fee based on your business assets, usually between $50 and $100 per year if you're just starting out. Next, you'll need to get an EIN from the IRS. That part is completely free, and you can get it online in about 10 minutes. You'll also want to secure general liability insurance, and I strongly recommend adding a professional liability policy too. Depending on your coverage and number of employees, expect to spend about $800 to $1,500 per year on insurance. Now let's talk timing. If you're moving quickly and you already have your business name picked out, you can get your LLC and EIN done in just a couple of days. Insurance might take another week or so to finalize. If you're building your brand, systems, hiring your first caregiver, and setting up your website, give yourself around 30 to 45 days to be fully ready to launch. And that's assuming you have support and you're not doing it all alone. Speaking of names, make sure your business name is unique in Wyoming. You can check availability on the Secretary of State's website. Avoid using terms like home health unless you're actually offering skilled nursing or therapy services. That can create confusion, and you don't want to attract regulatory scrutiny. Stick to names that reflect what you actually offer, like home care, companions, senior support, or something heartfelt that reflects your mission. Let's talk about policies and procedures. Even though Wyoming doesn't require a formal license for non-medical agencies, you still need solid internal documents. I'm talking about things like your employee handbook, a client service agreement, intake and assessment forms, caregiver job descriptions, emergency procedures, and ideally, a written infection control plan. That last one often gets overlooked. Some people think, well, we're just helping around the house, but in reality, you're in and out of vulnerable people's homes. You need clear protocols in place to protect your clients, your caregivers, and your business. Now, caregiver training, this is a big one. Wyoming doesn't have a strict statewide training requirement for non-medical caregivers, but please don't take that as a green light to hire just anybody. I always tell our clients, train your caregivers like your reputation depends on it, because it does. Best practice is to provide at least 8 to 16 hours of onboarding training, plus monthly continuing education. Topics like infection control, safe transfers, dementia communication, fall prevention, and professional boundaries all matter more than you think. Now, if you're ever considering offering skilled care in the future, things like nursing or physical therapy, that's a different ballgame. Skilled home health agencies in Wyoming are licensed and overseen by the Department of Health's Healthcare Licensing and Surveys Division. That route requires on-site surveys, clinical oversight, Medicare enrollment, and more. But if you're focused on companion and personal care for now, you're in the right lane to start faster and with less red tape. Now here's where I want to go deeper and give you something most coaches won't mention. First, your brand matters more than you think. Even if you're just starting, the way you present yourself sets the tone. Your logo, your tagline, your color palette, the way you answer the phone, all of it sends subtle signals of trust and professionalism. Don't copy what everyone else is doing. Create something that feels aligned with you and the community you want to serve. Second, start building real relationships from day one. Before you run any ads, go visit a local senior center, talk to someone at a church, offer to help at a caregiver support group. Wyoming is trust-based. People do business with people they know, so plant those seeds early before you try to harvest. Third, shadow your first caregiver. Even if you've managed teams before, go into the home. Be there for a real shift. You'll learn more in a few hours of hands-on experience than in weeks of online research. It will shape the way you hire, how you train, and how you lead. And finally, set up your digital systems early. Don't wait until you're overwhelmed to start organizing scheduling, payroll, care notes, or team communication. Whether you're starting small or already thinking big, putting solid systems in place now will save you so much time and stress later. Structure creates space for growth, for peace of mind, and for you to show up as the grounded, capable leader your community needs. So, if you're feeling called to start a home care agency in Wyoming and you want to do it the right way, with clarity, confidence, and heart, we'd love to talk to you. Our team at Home Care Agency Blueprint has helped hundreds of people launch heart-centered, legally sound, and thriving agencies all across the country, and we'd be honored to support you too. Just click the link below this video to book your free clarity call with our team. Whether you're still exploring the idea or already taking your first steps, we'll help you map out a clear path forward. We'll answer your questions, explain what's required in Wyoming, and show you what's actually working right now for new agency owners. No fluff, just real, grounded support from people who've done it. Thanks for spending a few minutes with me today. Wherever you are on your journey, remember, you have everything within you to build something meaningful, impactful, and lasting. I'll see you in the next video.